us. We're gonna get started in just a minute or so, gonna give time for others to join. But in the meantime, as we wait, we'd love if you all are interested, if you could put your name, organization, and the city or state you're joining us from in the chat so we can get a feel for who's in the room. Okay, this is really nice. Looks like we've got folks from all different corners of our state, and we've even got some folks joining us from other parts of the country. So happy to have you all here. We are going to go ahead and get started. I think we've got a good group, so we can go ahead. So thank you all for joining us for today's webinar. We will be discussing how policy can impact violence prevention initiatives. And our hope is that from today's webinar, you will be able to take what you've learned from the discussion to better leverage policy for your local prevention and intervention efforts. My name is Ciara Scott, and I am the director for our North Carolina Office of Violence Prevention. And for those of you who may not be familiar with our office, we are a newer office here in our state government. We're housed at the Department of Public Safety, but supported in close partnership with the Department of Health and Human Services as well. And when our office was established, we were tasked with working to coordinate efforts across the state to reduce violence, harm from violence, and firearm misuse. And we work towards that mission by centering the public health approach and engaging in cross-sector collaboration to support local communities in deploying evidence-based programs and strategies. And as of right now, our office has narrowed in on community violence as the focus area for our initial efforts. And so related to that, back in November of 2024, we released our first community violence prevention strategic plan. And this was developed in collaboration with our advisory board and various partners. The plan is centered around three primary goals, as you can see outlined on the screen. And these goals will guide our office's efforts around supporting and enabling community violence prevention work across the state for the next couple of years. And we are working on implementing that plan right now. And so just about everything that we do as an office connects back to the strategic plan in some way or another, including today's webinar. And so each goal has objectives that are outlined, and today's webinar is specifically helping us make progress towards the one that you see circled on the screen. Again, with us hoping that you'll have some takeaways that can better support your implementation of prevention and intervention activities in your local areas. So before we get started today, I do have a couple of quick housekeeping things that I need to cover. So we will be doing a formal Q&A towards the later part of today's discussion. And so throughout the webinar today, if you all have questions for the panelists that come to mind, feel free to put them in the chat as they come up. You don't have to wait to the end. We'll be monitoring the chat and collecting those throughout the discussion. And you can find the chat at the bottom right-hand corner of your screen. And then today's webinar will also be recorded, so feel free to take notes, but you can also watch it back and continue to pull those nuggets that you get out of the discussion. It will be made available on our website in the next couple of weeks, and we'll send a follow-up email with more information about where you can find that link. And so without further ado, we're going to move into the panel discussion. I'm really excited about the panel that we've been able to put together and really appreciate these folks taking the time to share some of their insights with you all. And I'm going to pass it to Desiree Lakey, who is a program coordinator here at our office, and she will be moderating today's discussion.
Thank you, Ciara. Hi, everyone. Welcome. Thank you so much for joining us for this discussion on advancing community violence prevention through policy. We'll be exploring how policies are formed, how advocates can engage effectively, macro level decisions translating to work that's on the ground, and the best practices for how we evaluate and refine those efforts. We have a really great panel today. I'm really excited to get into this conversation. Each of them have a really great experience in policy development, community organizing, implementation, and evaluation. So to get started, I'd like for each of the panelists to briefly introduce themselves. Just tell the audience your name, your organization, and a brief description of the work you do. Natalia, we'll start with you, and then we'll just do Mike, Crystal, and then Rob.
Hi, good morning. Natalia Botea. I'm the director of the Public Protection Section here at the North Carolina Department of Justice. And our team, I like to think of it as really the policy and public engagement arm of the Department of Justice. So DOJ, touches on a wide range of policy issues, but because the AG's work, a lot of it is focused on consumer protection and public safety. That is where kind of a lot of our work lies. Prior to this role, I was a policy advisor in the governor's office, and so was involved in the executive order that started the Office of Violence Prevention. I'm also a lawyer and started practicing in Charlotte, so excited to be here.
Hey, you guys, I'm Mike McLively. I'm the policy director of the Giffords Center for Violence Intervention. So if you have not heard of Giffords, we're a national gun violence prevention organization named after Gabby Giffords, former congresswoman who was shot back in 2011 while hosting an event for constituents. So we do work all over the country, including in North Carolina, but at our Center for Violence Intervention, really focused on advocating for policies that will get resources and support structures to folks who are doing CVI, community violence intervention work on the ground in community. So we help organize statewide coalitions to do that work and then create a bunch of platforms to bring folks together from around the country to talk about what's working, what we need to do better. So really excited about this conversation. And I'll pass it over to, I forget who you said is next. It's either Crystal or Rob.
Crystal, yes.
Good morning, everyone. My name is Crystal Harris. I'm the director for Durham County's Community Intervention and Support Services Department. Currently, my department houses our gang prevention and intervention program called Project Build. We work with youth and young adults between the ages of 10 to 21 around pro-social activities, skill building, case management, and just getting them referred to the resources that they need to be successful. Currently, I'm also working with our city partners on a joint city-county violence reduction plan. I have served on the Office of Violence Prevention Advisory Board, and currently I sit on the Governor's Gang Prevention Task Force. So happy to be here.
Hi, I'm Rob Wilcox. I am the CEO of the Fund for a Safer Future, which is a donor collaborative of 35 philanthropies that have pooled their resources to support gun violence research, policy and legal strategies, and offices of violence prevention that are doing kind of exciting work. I've only been on this job 40 days, so I'm still, I would say I'm learning where the bathrooms are, but it's remote, so I work from home, and so I do know where they are. Thankfully. But before this, I served at the White House Office of Gun Violence Prevention and got to work with Ciara and others to really try to develop an all-of-government approach to reducing firearm-related harm. And before that, I was in the policy space at both at the state and federal level and had the privilege to work with your Senator Tom Tillis during the negotiation of the Bipartisan Safer Communities Act, which was the first significant federal legislation to pass in 30 years, and really excited to be here and be part of the conversation.
Yeah, thank you all. And again, thank you all for being here today. I'm really excited to get into this conversation. So let's start at the beginning of the policy journey. Before policies can, impact communities and systems, they have to first be developed. So let's talk about the foundation of policymaking. Natalia, can you talk us through how policies are created? What do those stages look like, and how are those ideas moved from a concept to an actual adopted policy?
Yes, so that is a big question, and I will try to do my best to share something helpful on it. First, I want to kind of preface this by saying I'll talk about the North Carolina legislative process a bit and give a primer on it. I want to start by saying that there are a lot of policy levers at play beyond the legislative process. So I've worked for the past 6 years in the executive branch, whether formally through executive order or more informally, in the way that the rubber hits the road. The executive branch has a lot of policy levers, at its disposal, as of course does, local government, who can be a really exciting incubator for change. And I know we have philanthropy represented here, and kind of the way that philanthropy can help seed innovation in the policy space is really important. So there's more to look at beyond the legislature, but I'll share kind of the mechanics of how a bill moves through the legislature in North Carolina. So, we have a part-time legislature. This is an even numbered year, so it's a short session year. Everybody's up for election in the House and the Senate in North Carolina in even numbered years. So they'll start session in April. That will last for a few months generally. On our odd numbered years, those are long session years, typically start in January and can stretch into the summer and beyond. Typically your long session years are when, in theory, you should see, a state budget passed, which North Carolina is, I think, the only state in the country that does not have a state budget right now. So we divert back to the budget that was in effect previously, unlike the federal system. But your long session years see your budget development process, as well as the majority of your policy ideas for new policies. So they work their way through the legislature. Any one single legislator can introduce a bill. Often when we see the co-sponsors of a bill, that can be an early sign as to how much traction a bill may have. Are there bipartisan sponsors? Are there influential sponsors? Are there a number of sponsors who are signaling their support for a bill? After a bill is introduced, it is referred to a committee. Statistically, the vast majority of bills that are introduced, are not going to become law in that year. But your bills almost all get assigned to a committee. That's an opportunity, if it's heard, that's probably the first time that the public may get to engage, directly with the legislature on a bill. Sorry, I'm not a flow chart person, so I get a little distracted. But after a committee, it goes through second and third reading. I think of the reading is basically the process of debate. So the second reading is when the legislators debate a bill. The third reading may be perfunctory, or depending on if there are changes that have been made, the bill may be redebated at the third reading. Then the entire legislature of that chamber votes, and then it's sent, if it started in the House, it goes to the Senate, and vice versa. If the second chamber, passes identical legislation, then it's good to go and, would go to the governor. If they make changes, then it would have to, be referred to a committee to discuss and reconcile all of those changes. So after it's been through, the House and the Senate, it goes to the governor. The governor has three options. He can either sign it into law, he can veto it, or he can let it become law without his signature. And if the governor vetoes a bill, the legislature has an opportunity to attempt to override the veto. A couple things about North Carolina. We don't have a line item veto. Some states that do. That creates a very then the governor becomes a very powerful kind of negotiator in the legislative process. We don't have that here, so it's a take it or leave it approach. And then we have a 3/5 threshold for overriding a veto, which is a bit lower than in some other states. So that is a very kind of quick and dirty overview of the mechanics. I would say kind of in practice, policy making is really about stakeholder engagement. So, the amount, and some things obviously pass very quickly, but typically, by the time a bill is in the legislature. For the ones that have gotten traction, there's been a lot of work behind the scenes to understand various stakeholder perspectives, to get competing stakeholders on board, to get that input into the process. Policymaking or legislative policymaking is very iterative, and so I think we're going to talk more about strategy, but I'll pause there and see if my colleagues want to chime in.
Yeah, I'd love to open it up back to you and also to the rest of the panel. What are some key considerations when creating and advancing, so specifically violence prevention policies? What are some things that you all have seen been effective when developing and drafting those policies?
I'm happy to jump in real quick. I mean, that's a great overview. I think a lot of it, from what I've seen, stems from need. What do people in the community need? And at Giffords, when we started doing community violence intervention work and supporting it, I should say, back in like 2017, 2018, I'm in California. I didn't say that at the top, but I'm based near Sacramento. And it was a lot of going around our state, talking to folks who do that work on the ground and saying like, okay, what's the situation? What do you need from the state government? And the answer pretty much across the board was, we need resources. We need funding. The work is funded sporadically. When we looked at California, we had like $9 million in our budget, which for California is like very little, to support community violence intervention work. So that was the first step, was like getting input from people who are doing the work that will be impacted by the policy. And that's true of any policy, but I'm talking about community violence intervention right now, and creating coalitions to be able to have a platform to give input. So at this point in California, we have a large coalition that started with like 5 people who are saying we need to make some changes. There's this one grant program that's only funding law enforcement. There's a bunch of other law enforcement grants. Let's see if we can bend that towards community, which we've been successful in. And now every year we've got dozens of organizations from around the state that are before the session meeting to say, okay, based on this past year, what needs to change? And it's really helpful because we are advocating for resources. We then have folks in our coalition who are receiving those resources and can say, here were some of the problems with the grant making process. Here's what we want to see modified. And then we can develop that as a group and take it back to the legislature. So I guess what I'm trying to highlight here is creating some kind of process. And I know North Carolina has a community violence coalition that my colleague Juan Carter participates in as part of Giffords, but that kind of structure is incredibly important to get a feedback loop from anyone who's going to be affected by the policy, because all this stuff is how it gets passed, which is so important, but then it's going to get implemented, and you're going to need to find out how is it actually, shaking out on the ground.
Yeah. Thank you, Mike. And I also wanted to ask about, specifically when developing policies, we've seen sometimes policies don't come with a dedicated budget. So how do you ensure a dedicated budget line item is actually included in the policy ask? And that's open to all of you.
I think to kind of build on the kind of first comment Natalia made, which is policymaking is much bigger than just the legislative process, because so much goes into successful policy. And I think my one piece of advice is, don't just think about policy as an output, think about the outcome you're going to seek through that policy. And I think all of us here in this issue space would say it's violence reduction. And so then you're kind of saying, well, I know that I want to start a new grant program that is going to look a certain way, and I'm going to write that into law. But then you also need to make sure that there's money appropriated for it. So that's either going to be federally, you can do that directly in a bill, or you have to do that through the appropriations process. And then the executive branch has to implement that grant program and will issue requests for proposal and set standards and review grants, and then hopefully get that money out in a timely fashion. And so to be successful in the outcomes we're seeking, I think, as Natalia was saying, it really is about all those various stages of policy. And then I think what's often forgotten about it is that we have to then talk about what that's looking like on the ground, because it's not just about the work we do in a legislative chamber or the dollars we unlock. It's how does that show up in terms of programs that are being funded, doing work on the ground, and then we're telling the legislatures and the executive branch about that so that they can see the benefit of that work, and then they can be excited about continuing it. My experience in making policy, I'll just say, is didn't follow the kind of linear path. When the senators negotiated the Bipartisan Safer Communities Act, and I offer this because I think it's important. You just have to be ready for the moments as they arise, which don't always follow the streamlined pattern. And so this was an instance after, national tragedies, one in Buffalo where a white supremacist brought an assault weapon to a grocery store, and that horrible shooting in Uvalde, Texas, where a bipartisan group of senators came together to figure out what could be done to reduce violence. And they just started with broad categories of like, well, how do we want to address this? Do we want to think about some gun policies we could agree on? Do we want to think about some mental health funding we can agree on? Some community violence intervention funding we can agree on? And so I think I offer to you that this is the official roadmap, but oftentimes these things happen really quickly, and it's about being prepared in those moments to make sure that you can get information really quickly to the folks making decisions. You can articulate why it matters, and you can ensure that that's going to be part of the final package.
Yeah, absolutely. And thank you all for sharing your insights on the process. Understanding how policies are created, definitely helps to demystify what can sometimes, very often, actually feel really complicated. But policy creation doesn't happen in isolation. Similar to what you all are talking about, there are several layers to it. It involves stakeholders, community input, and advocates. And Mike, you kind of started going into this topic a little bit. So building on that, from your vantage point, how can community advocates effectively engage in policymakers or with policymakers? What strategies have you seen work well, and what are some common mistakes to avoid?
Yeah, thanks for the question. I think this goes back to the coalition point I was making, and I can just illustrate this, I think, with what's happened here in California, where I mentioned we started a few years ago with a very small grant program that's focused on gangs and law enforcement, but we saw that it was funding really good CVI, community violence intervention work in Oakland and Richmond and Los Angeles. And basically our small group said, we want more of that. How can we get the state to do more of it? And we created a very small but now growing coalition. And I think I have a couple of slides that will show you some of this in action. Feel free to go through this. So yeah, this is showing you across the country. This is not just a California thing. We've seen CVI coalitions start to grow and take root in more than a dozen states. So if you look at the map, is just blank in 2015. There are no state level community violence coalitions at all, at least that we were aware of. And you fast forward to last year, and you're seeing more than a dozen states on there have coalitions represented. And that's so important because coalitions, and you can go to the next slide, are basically a mechanism to get our policy asks in front of legislators. And in California, we now have a very large grant program that's giving out hundreds of millions of dollars each grant cycle to support this work. Whereas I was saying a few years ago it was 9 million. So it's increased a ton. And this is part of why you can see on this slide, we put together large events that bring a huge kind of coalition of folks who are doing the work. And in this picture is Sam Vaughn, who runs the Office of Neighborhood Safety in Richmond, which just had last year its lowest homicide rate of all time, with only 5 people being killed in a city where they were regularly having 40 plus people killed even a few years ago. So this coalition provides a mechanism to get these stories in front of the legislature. And it's incredibly important to keep that pressure up year after year, because legislators will forget, new people get elected. So you can go to the next slide. And what we found is it's incredibly important. This is just the types of groups that are in our coalition. So you've got national gun violence prevention groups like Giffords, Everytown, Brady, but then you've also got tons of groups that are doing the work on the ground who have come together in this powerful alliance. So if you go to the next slide, we've seen in state after state that the people who make the most powerful case for this work are the people who are doing it on the ground. That's not me. That's frontline violence intervention workers who can talk to their legislators and their staff and say, here's what I'm doing day to day, and here's why it's saving lives. And when those conversations happen, there's magic in the room. I've seen it firsthand. So this is from experience, but legislators and their staff really understand, oh, wow, that's what you're doing. I had no idea. And it's really an educational thing. Like legislators don't really understand this work, but when you walk them through it, especially with a powerful story of how the work actually looks on the ground, they get it quickly and they become champions. So this just illustrates, like, we started with seriously 5 people who are pictured there walking around Sacramento, and it has grown to become a big movement in California that's got a lot of people and power behind it. And 2 years ago helped pass the nation's first state level tax on the sale of firearms and ammunition to create sustainable funding for violence intervention work. So we've been able to get really difficult things done through the power of people who are doing the work, organizing to create a platform, which is our coalition, and then in a very sort of strategic, coordinated way, lobbying and advocating for the work to be funded in the way that it should be. We still have a lot more work to do, but it's that sort of thing needs to continue to happen all across the country.
Thank you, Mike. And I'd also love to, open it up to the rest of the panelists as well. You kind of talked about, Mike, kind of keeping the momentum going because sometimes legislators forget. And along those lines, especially when we see legislative priorities shifting, what tips do you have to help keep those violence prevention policies on the agenda?
Yeah, it's a great question. I'm putting this here in the chat because this actually just came out of Virginia and this is another example of policy at work. So there was legislation passed, I think it was last year, that instructed what's called JLARC. It's basically their like legislative research branch to do a report on community violence in Virginia. And what this report shows, and I would encourage anybody in North Carolina or wherever you're tuning in from to take a look at this, but it basically confirmed everything we've been saying, which is violence is concentrated in a small number of places. In Virginia, it's like 9 cities represent 50% of gun homicides. I bet that North Carolina is very similar dynamic. Most states with community violence have that same dynamic. But basically, the legislature itself sort of gave its blessing and approval to what we've been saying, which is you need to invest in those disproportionately impacted communities. And we have a budget process going in Virginia right now where that report is being referenced. So my point here is, we can say it from the outside, and it helps to have sort of internal validators. And JLARC for Virginia is a very like respected, nonpartisan research group, and they're saying what we've been saying, and that really helps to have it coming from different angles. So the other one is just like keeping up meetings all the time. We try to encourage our coalition members to go meet with their members, create relationships with them. We'll host press conferences. We'll try to get, we just created a communications committee in our coalition to try to get like a regular drumbeat of media, and then like claiming the narrative. In California, we have all these cities that are having record levels of success. Like San Francisco is lowest homicide since the 50s, Oakland lowest since the 60s, Los Angeles lowest since the 60s. So we have this amazing narrative. And I think the default is looking at law enforcement as the only explanation. And so we're really trying to host more events and go on podcasts and educate the public. And all those things help to kind of keep the pressure up. But we have to be able to tell the story of like, California made this huge investment. Last year's our lowest homicide rate on record in many cities. And it's not a coincidence. Like, that is part of why.
Yeah, I'll just chime in and add, I mean, I liked how you used the word momentum because momentum is a really powerful force and success begets more success. And so I think before I had any exposure to the policymaking process, I had a misconception that like, an issue has a moment and you get one bite at the apple. So you need to pack it all in and seize the one moment that you have. And I think maybe at times like there could be some truth to that. But I think what I've seen on the ground is that usually if there's an appetite to look at an issue in one session or 1 year, it means the appetite is there to continue to revisit the issue and to build upon, success or challenges. And so I think, a lot of things do start small, like Mike was mentioning. And so looking at, if an issue is not ripe for the big transformative change that you would eventually like to build to, things like a demonstration project or even a 2-year study can lay the foundation and build that support over time.
Thank you. And thank you both. So we talked about how policy is formed and how advocates can influence that process. So let's now shift to impact. Policies can be written or typically are, written at the macro level within legislators, but their real power shows up within the communities. So with that in mind, Crystal, I'd love for you to share some examples of how you've seen macro level policy translated into micro level actions in communities.
Sure. I think one of the biggest ones that I've seen is when the federal government basically started looking at violence, specifically gun violence, as a public health issue. I think that was the biggest one that we can say for this conversation. At the macro level, you actually saw that there was national funding for prevention, not just on the enforcement side. You also saw the CDC and state health departments authorize studies around violence trends. And then that trickled down to the micro level, which is our local health department starting to hire violence interrupters and street outreach workers. Hospitals started to launch their hospital violence intervention programs. And then you had neighborhood, organizations that started to do more of, implementing different strategies and models on the ground. And so I think that's a direct showing how directly a macro policy kind of brought down to a micro level, where you basically have here's the policy that's been created, and then now I have a street level worker that's mediating conflict before it can escalate to something else. So I think that's the perfect example to show how that policy from macro to micro.
Yeah, thank you so much, Crystal. That was a really great example. And so what are some effective community violence prevention policies that you've seen from your perspective, and how have they been implemented successfully?
I think one of the biggest things as far as implementation and being successful is around consistency and having where you have coordinated action. And so the biggest thing right now, a lot of these programs that came out of this policy are basically funded by ARPA dollars. I think a lot of the Office of Violence Preventions were created through ARPA. And now we know that this year, most of those ARPA dollars are ending. And so you have to have multi-year support and funding in order for it to be sustainable. And I think that's where cities have to kind of say, this is what we want to invest in. It can't be a priority this year, but not a priority next year. And so I'm thinking, for me, I think that those successful CVI programs have to have those multi-year funding support. You have to have your collaboration and training with your hospital violence intervention programs. We have one here with Duke University. Those are the ones that are seeing the gunshot victims at bedside, doing their assessment, determining what resources and services they currently need and how they're able to get them to those resources and connect them with other organizations and partners. I also think that when we kind of invest in youth employment, that also will help reduce the violence. We know that there are seasonal times when violence start to spike. A lot of that is during the summer. And so if we invest in those youth employment programs, in mentorship opportunities, I think all of that, when we start seeing the implementation of those types of programs and that funding being very sustainable, I think we will see over time violence reduced in our communities.
Absolutely. Thank you for that. And I'd love to also, open it up to the other panelists as well. If whether or not you all have seen implementation succeed, and what conditions or supports helped make that community level adoption of those policies possible.
Crystal, that was a beautiful answer, and I really loved how you connected I think what the hope was at the federal level down to the local level, and I want to elicit a couple points from that. I think one is you really need a conscious understanding of the different levels of government and the roles they're playing that gets you all the way down to the community level. And so when I worked at the federal level, I was very intentional about how what we were doing could be supportive of those working at the state level who have a closer vantage point, but then even more down to the local offices of violence prevention. And I saw so many of them on this call that are even closer to the ground. And then to your point, Crystal, you have our community-based partners that are even closer to the ground. And so I think like understanding how each level is working together and adding is really important. I think number two, it's really having a good sense of data. And I shout out to Ciara in the office, because I think you really are, and I've told you this before, pushing forward and with new data systems and visualizations to get a better understanding of where violence is happening, where it's rising and falling. But we have to have a real firm grasp on that, because then that can help guide our interventions and our strategies and our investments. But I think the evolution of data isn't just to show us where the violence is occurring, but where's our investment? Where are our solutions? So to Crystal's point, if you're seeing the data show a spike in violence during the summer, well, then one of the things we should be seeing in our chart is an investment in summer youth employment, because we know that that can be very important, both for economic opportunity, but all the evidence shows in reducing violence. If we're seeing kind of concentrations of gunshot injury, what is the kind of HVIP programming and where is it set up and how durable is it? And so I think that's a number two to kind of get from macro to micro, is you really need good data systems to both get close to real-time data on where violence is happening, but also pairing that with where the solutions that we're investing in. And the third thing I'll just say to add on to Crystal's point is we definitely need sustained, consistent funding. And I think part of that is moving from a grants mindset to a line item mindset, because like that is the sustainability we need. Not to say that grants aren't important, especially to expand work and to innovate, but having a line item is very important to show that like there'll be consistent funding year after year. I think the second thing that we should be very conscious of is we put so much money into the programs the past few years that we have to be conscious of sustainability, not just in terms of the dollars, but in terms of the people who are working there. The individuals on the front lines in a health system or a community-based organization are doing incredible life-saving work, and those careers need to be thought of, and that individual's wellness needs to be invested in so that they can both kind of grow with the work, but also we can deal with that trauma that they're undertaking. And we kind of are seeing this as a kind of permanent part of the workforce that has benefits and job training and things of this nature as we move from, and I don't know that anywhere in North Carolina is quite ready for this, but as you move from a place of crisis with very high levels of violence to reductions, then the question of sustaining them is how do you then change the programs you invest in? How do you move people around in the public health space to be effective? And I think that's the last thing I would say is that evolution takes a lot of thought and intention, because for us to be successful in this work, it's not just about reducing violence to some level, it's about eliminating it, then it's about sustaining it. And that just takes a different, more creative way to think about how the work evolves over time.
Absolutely. Thank you, Crystal and Rob. That was really insightful. Those examples definitely illustrate how policy moves from paper to practice and what actually, operationalizing those policies actually looks like. Of course, implementation isn't the end of the journey. For policies to remain effective and equitable, they must be assessed and refined over time, which you kind of started touching on, Rob. So Rob specifically, how are violence prevention policies evaluated, both in terms of outcomes and process? What frameworks or methods have you seen to be most useful?
It's a great question. And I think to what everyone's talked about is we really have been in a period of program and policy around violence reduction like we've never seen. From 2021 to present, we've invested more money into law enforcement efforts to solve homicides and stop gun trafficking, into community violence intervention, both at the programmatic level, but in health systems, in trauma recovery and victim services. At the federal level, we actually had for the first time a gun trafficking law that we used over 800 times. We regulated the ghost gun industry and shut down illegal websites that sold Glock switches that were put online from foreign gangs. that is just a lot of activity. And I think, and then that's just like the things that I'm thinking, that's the tip of the iceberg federally. Then there's all the things that happen at the state level, all the things that happen at the local level and the community level. And I say that all because we are at a critical moment where we have to try to understand how each of those levers, and there's a lot of levers, played a role in these reductions in violence. I don't think we should be satisfied with reading articles that say violence is being reduced, but we don't know why. You know, we will lose the thread of this work faster than anything if we don't force ourselves to do what is incredibly hard, which is to look across neighborhoods, cities, and states and say, when you see a national trend of this magnitude, what were some of the levers that were pulled that went into it, and not limiting ourselves to only looking at just one of them. Like, let's put all the weight on the back of a violence interruption program in Durham to try to explain everything, when we know as policymakers that we just pulled 1,000 levers. And I think the real challenge is, how do we pull together the funders? How do we pull together the experts to really inventory that, all that happened, try to look for consistencies and design a really big bet research project that gives us some true answers on, well, what really helped contribute to some of these reductions. And I don't say that because I think the work is done. We are far from it. In North Carolina, I know you've seen some reductions, but not nearly the level that you're seeking. And so you're committed to this work. I know that. But we should be interrogating that. If we see 3 years in a row of historic reductions, if we, as Mike said, we see some cities that are seeing levels of violence that they haven't seen in decades. The city of Camden, New Jersey just went a whole summer without a homicide. First time in 60 years. That's incredible for the youth of Camden. City of Boston had 24 homicides in 2024, 31 in 2025. Their homicide rate is 3 per 100,000. The homicide rate in Memphis is 48. Right? So a city the size of Boston is experiencing violence reduction in a sustained way. And I think we have to force ourselves to bring in our research community, give them the benefit of all the policy that's out there, and then truly design that research that's going to give us some insights into what's happened that's led to these reductions across the country, the places that they are deepest and most sustained, what's different, and where can we keep taking action to make sure that we don't just understand this work, but we sustain this work, and finally we explain this work. Because if people don't understand what's happening and the progress that's being made and how it's happening, then we don't create the momentum, as Mike said earlier, to keep doing it. And I know the governor and all of you are like deeply dedicated to that and deeply dedicated to public safety. So I don't offer that in the way to say that that's not where our intentions are. But I think we got to have a deeper understanding. We have to really be thoughtful about how do we sustain it and how do we then explain it. And to your very specific question, CR, because I don't want to act like I'm ignoring you, like there are a lot of particular, very specific research approaches that can study particular programs in particular places. There was just a study out of John Jay by a person named John Jay that looked at the HVIP program in Boston with 10 years of really reliable data that saw tremendous reductions that it could be attributed to the HVIP program, and he used a kind of a synthetic model, which is new, but actually is a really exciting new tool on how we can be evaluating community violence intervention work. We've seen some really interesting work in Chicago that tries to compare areas who have been served by a CVI program that those that haven't. I think we're seeing where my organization is funding research right now to try to better understand why we don't solve non-fatal shootings and how we can be improving the clearance rates there, because I think we talk a lot about clearance rates for homicides, but not nearly enough about non-fatal shootings. And so, like, I think there's a lot of good and interesting research that's happening, and I think having that research agenda that's both specific to North Carolina, because you have some amazing universities here, but also that is part of the national trend, is really valuable and important. So that we can sustain this work, we can innovate on this work, we can expand this work, and we could do what I said earlier, which is why we're all here, is not for outputs, but outcomes. Because when you look at this data and you see these declines, it's not saying this work is over, but it's recognizing, and for those doing this work, taking pride that when you see a decline, that means a family that's been spared the trauma of this issue. And that's a family that gets to go to a birthday party instead of a funeral. And I think that is why it's so critical we understand it, because this is truly a life or death issue.
Absolutely. Thank you so much for that, Rob. I'll open it up to the rest of the panelists if you all have any key metrics or anything like that on determining effectiveness to evaluating policies before I move on to the next question. Did anyone want to add some kind of final thoughts to that?
I would just say two quick things. I mean, one is I think getting government entities to care about this is a huge one. And in California, our sort of default for many years was they would collect data in a very minimal way, and then it would be set, but it took a lot of time. So this is another thing, is like, what are you getting out of your data? So we would have folks collect data for the sake of collecting data, and they would send it to our agency, and it would just sort of sit in this black box, and no one ever saw the results from it in a way that would be meaningful to show an impact. Now, we've done all this work to change our state agency, and to their credit, they've listened to us over the years and are now adding money to each grant to say, you have to use funds to evaluate your work. We're actually going to bring in a third-party technical assistance and training group to teach you how to do this. And we're going to do it in a meaningful way. And now they're doing the first statewide evaluation based on this data. So I think part of it is us holding government entities accountable to a higher standard of, like, we need data and evaluation that's useful, both to show impact and to show groups, like, how can you do your job in a better way? Because especially community violence intervention work is a science and an art, and it's always evolving and always being perfected. And you can only do that if you're really taking a close look at the work. The other thing I'll say is just how to evaluate. I think we need a lot more on risk factors and at the individual level, measuring folks' risk factors when they begin engaging with violence intervention work. And then after a few years of engagement or a few months of engagement, showing how those things have reduced. It's obviously important to look at homicides and shootings, but really this work is happening at the one-to-one level. And we need to continue to look at, how did this reduce risk factors for somebody who is at very high risk of violence when they entered into these services?
Thank you so much. That was a really great point, Mike. Yeah, so thank you all for walking us through how policies are evaluated and refined. Excuse me. Evaluation definitely gives us insight onto, what's working, what isn't, where the gaps are. And as we think about the full cycle of advocating for policies, and actually while I'm asking this question, I'll just remind you all that we're about to conclude. So we're about to hit our Q&A portion, of the webinar, sorry. And so just want to put a reminder to put your questions within the chat, so that way later on when we get to that Q&A session, we'll have those questions ready for our panelists. But back to my question, when we're thinking about the full cycle of, advocating for policies, creating them, implementing them, and evaluating them, that next step, kind of like what we talked about, is that momentum. So, once we understand impact, where do we go from here, right? So I'd like to close with us looking ahead, considering, your current work, all of your current work. Where do you see opportunity to advance policy efforts to addressing community violence?
For me, I have two that come to mind. The first one is around standardized training and workforce or professional development for violence interrupters or street outreach workers, those that are the boots on the ground doing the work of CVI. In my learning, I'm very early into the space of community violence, and what I've learned so far is that, they say that the life of the work as a violence interrupter is about 3 to 5 years. But then the thing is, how are we pouring into them to build them to have the capacity to do something else after 3 to 5 years? And so I feel like we have to have some type of standardized training for them to learn how to do their job appropriately well. That comes with cognitive behavioral therapy, they trauma-informed training, those types of things, as well as to help them be professional developed as they transition out of that. The second one is basically investing in our communities, in our neighborhoods for safe housing. So basically that is investing in our community centers, investing in lighting in certain neighborhoods. You know, if you have street lights that are out, that's not safe for, you know, for individuals to be able to move about within their community. So I think those are two things that we would have to invest in that will in turn show a reduction in our violence as we look at violence policies and violence intervention and prevention work.
Thank you, Crystal. Would anyone else
Yeah,
like to?
I can quickly, I don't know that I have something super insightful, but I can quickly chime in with a few thoughts. Like, I think more narrowly and specifically, I think in North Carolina, there's a lot of good traction, and there has been for a few years around the co-responder model. And I think that's something that we should continue to lean into and how that fits into the violence prevention world. And I think Karen in the chat was mentioning education, and I'm glad she mentioned domestic violence. And I know domestic violence is something that we work on in DOJ. And so continuing to look at the intersection of domestic violence and community violence, I think is really important, especially when it comes to primary prevention, because the things that prevent one will also, you know, prevent the other. And it's not because I think there's so much traction right now on primary prevention, but I think we just need to keep on it so that we're not backsliding and that we're continuing over time to build the culture that's going to reduce violence.
Absolutely.
I agree with everything that was said. Those are both excellent points, and I'll add, three quick things. One is we need to support offices like yours, Ciara, and local offices to be the kind of hubs within government that can help drive all of government work. I think it is essential that we have strong offices of violence prevention at the local and state level to really help connect the dots and help drive some of these programs that might not sit squarely in any one department, but need someone to help shepherd them and connect them through, especially in a place of honestly more limited resources. We have to be efficient. We've heard a few times ARPA dollars are coming to an end, so we have to be more efficient with dollars, and I think offices like yours and local offices can really help do that. The second thing I'll say to add on is we have to really be thoughtful about victim services, trauma recovery, mental health from exposure to violence. I think that is often overlooked because it happens after the fact, and we're obviously in the business of preventing. But to me, this work is a circle, and one of the best ways to prevent future violence, be it interpersonal or self-harm, is really trying to deal with that exposure to violence and really making sure that we're getting good victim services. And trauma recovery centers are a great model to do that. And lastly, I think it is also thinking about the kind of movement of illegal firearms and their parts, and like, what are we doing to make sure that there's not websites available in North Carolina that are illegally selling Glock switches. These are small devices that convert a semi-automatic handgun to a machine gun. They are illegal federally. They're illegal at the state level. I can tell you, when I was at the White House, what I saw was anyone could go online and order them. So we took action, and what we found was they were all linked back to China. They were being run by criminal enterprises, and a person could go online and order them directly to their house. And so we shut down 350 using civil asset forfeiture. We have to keep up those efforts, because I think as we invest in intervention strategies, as we invest in solving homicides, as we invest in victim services, we also need to cut down the movement of illegal guns, either through gun trafficking or stores that are willfully violating the law, or these honestly international gangs that are flooding our communities with some of these illegal products. And so that's what I would offer is there's a lot to do, but a lot has been done, and if we lean in, I think we can continue this progress.
Thank you.
Really quickly, I would just say rural CVI to me is a really interesting area that I'm trying to learn more about this year. If you look at that Virginia report, half of violence is coming from those 9 cities I mentioned, but the other half is coming from other parts of the state. And I think a lot of the dynamics are cities, small cities, where you might have 3-4 homicides in a given city, but if you add the region together, it's actually quite a bit of violence. And I think places, including North Carolina, are developing ways to respond to that community violence. And obviously requires a slightly different type of response than like dense urban area community violence. So at least at Giffords, we're trying to look close, like what are best practices when it comes to like less populated areas and addressing that community violence. And the other one is domestic violence. I think we're seeing in California a lot of reductions of community violence over, but domestic violence sort of staying flat. And I think part of it is from what I understand, there's less in the domestic violence space around working directly with perpetrators of violence, which I know is like politically difficult and might make people uncomfortable. But I think that's why CVI has been so powerful, because you're working directly with individuals who are perpetrators of violence and reducing their risk. So really interested in looking at the intersection between community violence and domestic violence and trying to move those numbers down. And the last thing I'll say is just institutionalizing this as a response. I mean, we already talk about law enforcement as like the default response to violence, but that is one side of a huge equation, right? That's the reactive side after the trigger's been pulled. So I think if we can just train our politicians and the public to understand that there's a whole set of solutions that happen before a trigger gets pulled on the community side, the prevention intervention side, that will change the politics of this issue. And I think there's a lot of opportunity in getting bipartisan support, eventually just realizing that this has to be part of how America responds to violence.
Absolutely. Thank you all so much. This was really great discussion. I'm gonna now transition us to our Q&A section, and Ciara is gonna go ahead and facilitate that. But again, thank you all so much. It's been a pleasure being your moderator.
Yeah, thank you all so much. This was a really great discussion. And we do have a couple of questions in the chat. And just a reminder again, if you all have questions, so please put those in the chat and we'll add it to the list. But to start, we have a question for the panel related to specifically around prevention. This person wants to know, has there been any discussion about instituting age-appropriate trauma-informed violence prevention curricula in schools? So I guess in your experience with moving forward policy in our state and in other states and cities around the country, is this something that you all have heard of, have seen, encountered?
Well,
I don't know if
Ciara,
any
I
of
can.
the-
Go ahead, Natalia.
I don't know the answer to that question. I don't know if any of the national folks have seen it, but I think I know where to get the answer, at least in North Carolina. So I'd be interested in exploring that with you, Karen, and I put my contact information. Crystal, is that something that you're familiar with in Durham?
So, not specifically to, more specifically to gang prevention and intervention, which is the work that my department has right now. What we're trying to implement now that we're doing prevention, we are working with Durham Public Schools to implement some curriculum that talks about gang prevention work. We already work with Lakeview, the school Lakeview on Fridays. We have during their intervention block where we actually talk about gang awareness and violence, some violence prevention and awareness education. So that is something that we're open to doing with Durham Public Schools. And so we're just trying to figure out the best way to be able to share that curriculum that we have with more than just the pilot that we've been working with Lakeview on.
I was waiting because I am not the expert in Durham, but I'll offer a few things that I've seen nationally. The Harlem Children's Zone, which is started by Jeffrey Canada with like a cradle to career mentality for young people, has a kind of really been building out their vertical on youth violence prevention. And I think it's a school-based program. I think that's really interesting. And there are lots of places across the country. There's a school-based program called Reaction in New York. That's run in a number of schools that are kind of in areas that students are exposed to violence. That is kind of pretty interesting. It's a separate curricula, but the schools have brought it in. It's been evaluated in some ways by John Jay. So I think that's good. And then, lastly, I think it does go to the point I made about kind of victim services and having a plan for trauma recovery, because I think part of it is if you know that the students in your school have been exposed to violence, classmate who was shot and killed, or a sibling, or even an act of violence in the community, I think schools, which have all gotten better at this, need to be building that affirmative strategy of they have to treat those kids as they come into the school, which means having some trauma recovery strategies, trying to pull down some of the bipartisan Safer Communities dollars for to hire and train school-based mental health professionals, which obviously is a struggle right now we see in most schools, but I think it is kind of being very conscious in building that part of the work.
Thank you all. We have another question that I think is a good question. Hopefully you all will be able to help this legislator who has joined the meeting. And so the question is that as a legislator, they have successfully appropriated funds for violence reduction in their community, which is also a historic first for them. But as a community, they have no blueprint to sort of move this forward. And so they're looking for recommendations from you all on where they should begin with trying to move forward those recently appropriated funds. As you're thinking, I'll also say they would like to connect with you all, and we will be sure to share contact information for panelists in the follow-up email, so you'll get that.
Yeah, I was gonna say I put my contact info in the chat. Happy to talk more about that. I think there are so many cities now, fortunately, that have put together really strong blueprints, and would be happy to send along some examples. I'll try to grab some right now while we're talking. But I think, and then there's a number of national, technical assistance organizations, like Cities United comes to mind. They're currently doing a statewide landscape analysis for Delaware. And there's like National Institute for Criminal Justice Reform, the Hobby, if you're talking about hospital-based violence intervention programs. Anyway, all these groups now offer the ability to like look at what you're doing at your city, put a strategy in place. So would be happy to have a longer conversation about what's out there, but there's a lot, which is good news.
Wonderful. Any other thoughts from the panelists before we wrap up? Not question. Okay. Well, thank you all so much. We've actually come to the end of our time. But as I said, we will make sure in our follow-up email that we give you all contact information to follow up with the panelists directly if that's of interest. But thank you so much for taking the time to join this webinar. Thank you again to our panelists, and really appreciate the insights that you shared with our community here in NC and outside. And for those interested in staying connected with our office, on the screen we've got QR codes to our listserv and our website, where you'll also be able to find the link to the webinar in a couple of weeks if you check out our website or the DPS YouTube page. And we will be sure to also share all of the amazing links and resources that were shared in the chat throughout the webinar as well. I just saw that question pop up. So thank you all, and have a great rest of your day.